Okay, well now it is time for your health headlines, and it's a growing trend, but how safe are water births and teenage boys in sports? A new worry for parents off the field.
The doctor is in. That's a new line. Dr. Evelyn Minaya is back on the couch to fill us in. So we were just talking about water births during the break. They are increasing in popularity because these aren't anything new, are they?
No, they're nothing new. It's from way in the
back.
90s. Oh, way in the 1960s and so on and so forth. It's increasing in popularity because more people want to have more control. At least they think that they do.
Are they safe?
Well, you know something. I think at the beginning of labor, where your stuff, you know, your contractions are not that intense, it's pretty good. It's relaxing and things like that. I've actually participated in a water birth. It is the most uncomfortable thing. As an obstetrician, I was pregnant at the time. My nurse was actually holding me so I wouldn't fall into the pool.
Oh my gosh!
But once your water breaks, that protection from that baby, okay, and for that baby is really, really gone. So that I also had feces in that pool of water, and that I had to take the patient out of that water because it's contaminated, and it really is a lot dangerous for the baby.
Why are they popular?
Well, you know, I feel like there's been a documentary.
Right, there was a documentary. This was in the 1960s, and if you remember, it's like Boyer and all of that stuff. And it was because we think that the amniotic fluid that the baby is surrounded with for 10 months, it's kind of like the same thing. It's quiet, it's relaxing for the baby, so the baby is not traumatized while in the birth canal and then coming out. The problem is that you have contamination. Also, the baby can take its first, gulp, and it's going to be contaminated water, and then you can actually get brain damage from that.
It is Manatee Appreciation Day, though.
Oh, yes, exactly. So
there you go.
There we go, swimming away.
Well, now moving on, there is a new study out that says teenage boys who play sports are more likely to abuse their girlfriends. This is troubling. Tell us about this.
I know, and you know something, it's only in football and basketball. It's not in any other sport. So it's aggression, and it seems like the aggression is not only played on the field but off of the field. And it's a cruel reminder that, you know, good sportsmanship, okay, it's all about that. Yes, it is about winning the game, but it's also good sportsmanship. So taking care of your fellow colleagues, you know what I mean? You know, in a soccer field, if you've ever seen it, hockey is the same way and things like that. You know, you high check somebody or you push them on purpose. In basketball, is the same thing. They're going up for the layup and you kind of knock them out. It's all of those things, and that coaches and also parents should also talk to your children that aggression, you know, competitiveness is not aggression. It's not the same thing.
But it's kind of mixed signals because they tell you to be aggressive.
To be aggressive.
I mean, there's a cheer even for it, you know? So, but then you have to let them know that that's maybe for on the court, not in their
anywhere, not anywhere else. And it's really deeper than that, I think. It's about respect. Respect not only for your fellow colleague, but also your teammates, so that you're not fouled out or anything else like that. But like I said, it's good sportsmanship. That respect will then play out of the field.
And respect for yourself, too.
Right, absolutely.
So there's a new study that shows medical marijuana can help ease the painful symptoms of MS.
Now, it's very interesting. This study, which was about 40 years of literature, it was actually done by neurologists, but it was only in the pill form and the spray form. When you looked at smoking the marijuana, it did not do as much effect as it did, in pill and spray form in terms of easing the pain of MS. And it's also the muscle rigidity and also the frequent urination that they get.
Oh, so is that the only side effect, the frequent urination?
No, actually, that's for it.
Oh, that's for it.
That's for it. So then the
side effects?
Yeah, there are side effects. Unfortunately, people with MS are a little bit more at an increased risk for high suicide rates and depression. This marijuana can lead to depression as well as seizures. So it's kind of like dangerous. So you have to
balance.
Yeah, you have to balance the risk and benefits of these treatments.
Okay, so now is it true? Can chocolate and comedy make your work a better place?
Listen, let me tell you something. Well, I might not have a lot of chocolate in my office, okay, but going your way, darling. I know for my husband, it's his birthday today, so I'm sending you chocolate.
Happy birthday!
Okay, happy birthday,
honey.
Yeah, happy birthday. But chocolate and stand-up comedy allegedly makes you more productive. You're a happier person. You know, you're not thinking about, oh, this is dredging and things like that. And you know, allegedly, you get even a 12% increase in your production. So I forgot some Hershey bars.
No, we should get some chocolate for Joan Rivers on Friday.
There you go.
We'll feel great.
Yeah, exactly.
Well, I'll tell you what. So an obstetrician walks into a bar.
Get out of here. Thank you, Dr. Evelyn Minaya. We appreciate you being here and filling us in on the health headlines
Always
this
good
morning.
stuff.
Thank you.